what would be considered premature?
Most definitions of PE use anywhere from 1 to 3 minutes. The average time to ejaculation is somewhere in the 5 to 7 minute range for most people.
If I'm in that 1 to 3, what can I do to get that to a 5 to 7? Hey everybody, I'm JC Mendoza. Welcome back to Uncomfortable Questions, where I get to ask questions to a doctor, questions that we're all dying to know, but might be too embarrassed to ask about. And with me, as always, is Dr. Pete. He's a board-certified urologist and a nationally recognized leader in male sexual medicine. Dr. Pete, it's good to have you.
Yeah, can't wait to hear the questions for today. Let's go.
Today we're gonna be talking about PE, and I feel like a good place to start is, what is that exactly?
Okay, so PE, usually in sexual medicine, refers to premature ejaculation, right?
That makes sense.
PE is one of the most common sexual dysfunctions, especially amongst young people. It's defined in various ways, but it really refers to kind of a triad of three things. One is very short ejaculatory latency. Usually that means ejaculating within 1 to 3 minutes of penetrative sexual activity.
We've all been there.
Number two, a sense of lack of control, where you feel like just what it says, right? You can't control it no matter what you do. You have that short ejaculatory latency. And thirdly, that it's associated with some sort of distress for either the person who's ejaculating quickly or their partner. So when those three things are together, that's how you make the diagnosis of premature ejaculation. And so there it is. That's what it is.
That's a lot. So big question that I want to ask, are there premature ejaculation pills that are safe to take?
Yeah, it's kind of a trick question because there's nothing FDA approved in the United States specifically to treat premature ejaculation. Now, just because we don't have an FDA approved drug here doesn't mean there aren't widely available other drugs that are FDA approved for other reasons.
That's like antidepressants or ED medications.
Yeah, exactly, right? So SSRIs and ED medications are two of the most commonly prescribed drug classes used for PE. So those are drugs that are used off-label.
Yeah, and that means they're prescribed to treat something other than what they've been officially approved to treat.
Totally right.
Yeah.
So even though they're off-label, we have really good evidence that they work really well. All right, well, let's talk about SSRIs.
Yes.
So that stands for Selective Serotonin Reuptake Inhibitor. SSRIs are drugs for anxiety and depression.
Okay.
They modulate serotonin function in the brain, but it turns out serotonergic signaling, so the way serotonin works in the brain, is involved in the ejaculatory reflex. So people that take SSRIs for anxiety or depression often have a side effect that's usually unwanted, where it takes them too long to have an orgasm or they even can't achieve orgasm. So for me, it's a daily medicine that's really effective, and it's one of our first-line agents to treat PE. And you can expect ejaculatory latency time, so how long it takes from penetration to orgasm, to increase anywhere from 3 to 4 to more than 10-fold.
That's amazing.
Yeah.
That's great math for us. And what about ED medications?
Yeah, that's a great question. So drugs like sildenafil, which is the active ingredient in Viagra, tadalafil, the active ingredient in Cialis, have been used to treat patients with premature ejaculation in a couple of different settings. So the first thing is that if someone has PE, but they also have any degree of ED, very clear that person should get an ED med, cure the ED first.
Right.
And a lot of the time that resolves the PE. But even in the absence of erectile dysfunction, there are clinical studies to support the use of sildenafil or tadalafil or vardenafil, which is another ED med, to treat premature ejaculation. It's not exactly clear how those drugs work to prolong time to ejaculation, but there are clear studies that suggest that they do. In addition to that, it's very clear that even in the absence of ED, using a medicine like sildenafil or tadalafil improves sexual quality of life, and it also makes it easier to get a second erection.
And we have all these medical treatments, which are great and great to know about, but I have here something called the squeeze technique. And it sounds scary, but I'm hoping that you can elaborate on it.
Yeah, so the squeeze techniques is one of two kind of behavioral techniques that are used to treat PE. Whether or not and the extent to which they work is kind of a little bit of a controversy, but I've certainly seen patients who have reported good outcomes with either of these techniques. The squeeze technique, which you're referring to, is literally grabbing the head of the penis and like preventing ejaculation when you get really close to orgasm. And it's a technique to get people used to getting really, really close to the edge, but then like a physical signal to kind of stop that.
Okay.
The start-stop technique is kind of similar. Some people think of it as edging, but that's getting really close to orgasm and then stopping all activity, letting everything calm down, and then resuming. So those techniques are certainly useful, that there's no medication exposure, but they don't work, at least in my experience, they don't work as well for most people as some of the other interventions. The other thing that we didn't talk about is kind of an in-between, which is the use of over-the-counter numbing agents to treat PE. So you don't need a prescription for them, but they do contain medicines, and these are sprays, wipes, and gels that contain, usually lidocaine or prilocaine. These are drugs that are related to like what a dentist injects to fill a cavity, right? And the idea there is that by, numbing penile sensation, you can prolong time to ejaculation. We know that that works from clinical studies. There's also risks of like transferring the numbing agent to your partner and causing genital numbness for them. And
everybody's just taking long.
Right, and then if you overdo it too much, you can't feel anything, you get ED. So there's an art to using...
Delicate balance.
Right, there's a delicate balance to the topical treatments, but they are a really good option for people.
That makes sense, and that's great to know. And honestly, I think that's all for today. So Dr. P, thank you so much for taking the time to talk with me about how guys can treat their premature ejaculation symptoms. And honestly, I wish there was a way to make this conversation last a whole lot longer.
So do I.
Thank you so much for all your help. And guys, you should stop and squeeze that like button. Remember to subscribe, comment, and check us for more content.